are live on our social platforms. Hi, everybody. I'm Danny and Dr. Ryan with Fresh Skin.
Hi, everyone.
We're going to just wait a couple seconds here and get started. We have a really fun topic that we're going to be reviewing today. Good morning. Let's see if I can see you. I'm sorry, I can't see that far, but hi to anybody who's joining us. We're going to go ahead and get started. Today we are going to be talking about body contouring, body sculpting devices. We want to start by kicking off, why did we pick this kind of topic, right? Like, it's summer. This has been super popular. I've had a ton of patients. You've had a ton of patients. We've been real busy with body treatments this summer.
Yeah, body treatments in the summer, a lot of people try to, prepare for the summer. They do all their body treatments in the spring, and then they kind of let their bodies go in the summer. They just, enjoy their time.
And then they put the bathing suit on, and they're like, wait, when? So what's it that you have to, remember this in the winter, too, right? Winter, spring, but all summer long you can do these treatments.
Well, that's what's great about body treatments now. Technology allows us to do it year-round.
Yeah.
It's not like we have to worry, about sun exposure or, when we're not wearing clothes, we have opportunity to see all of the things that we let go throughout the rest of the year. But
or the things that we thought we were working so hard on, and then you're like, I don't understand. Why do I still have a pocket here or wherever it is on your body that is stubborn or bothers you? So something that, we as a practice talk a lot about whenever we are vetting any new product, any new service that we bring in. We go through this array of services that we review, right, and decide which one are we going to bring on. And both of us have been in the industry a long time, and there are many, if not hundreds, of devices out there that do body contouring, body sculpting. And some of the more popular ones use a more cooling technique, right? So like a cold approach to reducing fat. But in our practice, we chose to go with one that uses more of a thermal or heat approach. And Dr. Ryan, do you want to just talk on a little bit why we chose that approach versus a cooling approach?
Yeah, like Danny said, we've been in the industry a long time. Danny's been a trainer for multiple companies. I ran a research institute for device-based treatments and FDA clinical trials for those types of approvals. And we've seen everything out there. And, I historically didn't trust body devices.
Well, in my background, I worked in plastic surgery, and we've talked about this plenty of times. I'm like, it's hard to find the one you love or the one that really is that go-to, and I feel like we found it with PHYSIQ. Yeah. But again, just why cool over heat? It's so pertinent.
There are devices out there that use different technologies to body contour, whether we're trying to tighten skin, reduce fat, tone muscles, essentially just improve the body shape, let alone what we're trying to do with PHYSIQ, which is also improve body composition, which is a little bit different.
Right.
There are devices out there that use different technologies like radio frequency or cold therapy or magnetic stimulation or electrical stimulation. They all have benefits. They all can do different things well. The current devices on the market that use cold therapy, they target fat, and they target fat pretty well. The reduction in fat that they provide, I'm not that impressed with, but it does work. The issue I see with those types of devices is that it's very targeted to a specific area. It essentially has to pull in the tissue in order to create the pocket of fat that it's going to go after, and then create that effect, that cryo effect in order to destroy the fat, and then it takes a period of time afterwards, weeks, if not months, to completely, resolve. Thermal, light-based, laser-based energy is a little bit different. It doesn't have to end at the handpiece.
Right, which is
we have
super
this
nice.
handpiece. The diodes of PHYSIQ are actually positioned at 120-degree angles, so it's angling outside of this square.
So, if someone was to put this on, right? It's not just this square. I'm giving examples of areas that we see: inner thigh, top of the knees.
Right.
It's not just hitting that square, right? We're able to successfully create this overlapped area, depending on where we're placing the handpieces, and target fat and skin and muscle more effectively than we would if we were just targeting one thing, right? In
Right.
one area, very isolated to that area. And how many times people come in and they don't say like, well, it's just this little handful here. It's typically an area that, you know, starts to disperse and you have
and it's
to
a
target
more
all of
natural
that.
result then, because you're
Absolutely.
also getting the true contour. You're targeting the fat pocket that you don't want, that love handle you don't want.
Right.
But then it's also spreading a little bit around on the area, so you're not just getting a square reduction
Right.
of fat.
Absolutely.
But also with the PHYSIQ device, you have these electrodes on the edges that allow you to stimulate muscle, so you're also targeting muscle toning.
Right.
The real key to PHYSIQ, in my opinion, and with why the results look so good,
Right.
is because these diode lasers aren't, I mean, they are targeting fat, they are targeting the depth that you want, but they're passing through the collagen and elastin, stimulating that structure, that foundation of the skin, that will then also increase body contouring, skin tightening.
And I think that, you know, most clients will say, I don't like this fat, but if you get rid of the fat, you still have to, you know, secure or keep the quality of the skin, right? You can't
because
reduce
otherwise you just have
right,
skin hanging.
right. So there's a component of ensuring that the collagen matrix or the foundation of your tissue, you know, everything that's hoisted up, protecting the inside, is also tight and at its best quality, right? So we are always, everything that we do, we want to maximize your results, right? Nothing that we do haphazardly. Nothing that we do is just a one and done. We always take a very comprehensive approach, right? So we always say, like, you know, if someone comes in, anybody can be strapped up to PHYSIQ, but what's the most ideal client, right? Someone who is, and you touched on body composition, but has a ideal or close to ideal body composition. Someone who doesn't have, you know, several tens of pounds that they want to lose, which we can address, but we do that in a very comprehensive kind of step-by-step approach.
Yeah, we may, you know, when we do a body consult, we are very realistic. We're going to ask, you know, we're going to take some photos, we're going to take some measurements, and we're going to say, all right, show me, point out in these photos what's bothering you, what you really want to see change, and what shape do you want to see when you're done. And in some cases, if someone is larger and is struggling to lose fat through exercise and diet, we may still do it, we may still treat, because we can help debulk certain areas that are resistant, that are just saying, you know, where the body's like, no, I'm not losing that fat for whatever reason, whether it's genetic or.
Well, we also
or
have
some other
athletes
reason.
that are in our practice, right? And you would think bodybuilders that come in and see us, and not just for muscle toning, but they too say, you know, this is literally my job, is to work and have a perfect body composition, a great shape. But there's always, you know, one pocket, whether it is, like you said, age-related, genetics, lifestyle. There's so many things that can contribute, and it's great to have options that are non-invasive, no downtime, comfortable, right? Like, that's a huge thing, is to have a comfortable treatment that you can come in, have done, and anticipate seeing a decent amount of results, right? And everything is going to be customized, and we will gladly, you know, go through expectations of what your body specifically can expect.
Well, and we're not limited by size of the area. We have 4 hand pieces about the, you know, a little bit larger, let's say, that, you know, about the size of an iPhone. So if we want 2 areas, lower abs, we can treat, but we can also double it up and have 4 and get the whole
Or a lot of times we have people that are looking to do a little bit on their hips, not necessarily full planks, but their hips and their lower belly. You know, like I think it's really common with moms or post pregnancy is that we have what we like to call, well, I think anybody can get it, but I hear it a lot with all my mom friends, is that we have this inner tube. Right? Like, I'm like, it doesn't matter what I do. It doesn't matter how many planks I do, sit-ups I do. It doesn't matter how many times I go to work out. It's just this one separate area, and I feel like it goes all the way around.
Well, and it goes back to what you're saying about skin tightening, because it's not just fat. There's also just stretched out skin. We need to revitalize that collagen and elastin and reattach. Plus, the abdominal wall is stretched out from pregnancy, so when we can target the muscles of the abdominal wall to tone those at the same time to tighten all that, tighten that area. So we just have a lot of versatility with this device that really doesn't show up on many of the others on the market. So
and they're not all created the same, right? Nothing is created the same. They all have similar goals that they're trying to attain. We have found a lot of success with PHYSIQ. We have other platforms in our practice that we also use in combination for like a mixed modality approach. You know, Dr. Ryan is phenomenal, and many of our clients, you know, can attest to that. We have clients that see both the wellness and aesthetic side, but can attest to saying that Dr. Ryan can really help get you in a path or on a regime of supplements to help maximize just your overall health. And then we can also add in the services that help contour and make you feel your best.
Yeah, because there are a lot of reasons why.
In a bathing suit or in a hoodie. I like wearing hoodies and sweatpants
and still feeling tight
ball,
and still knowing, you know, what your body comp is underneath. You know, there are a lot of reasons why your body is doing what it's doing. We like to discover what those reasons are and then figure out the optimal path, you know, to recovery and get you where you want to be.
Let me think. If anybody has any questions pertaining to body contouring, body sculpting, skin tightening, fat reduction, please feel free to put those in the comment section, or if you are more comfortable, you may private message us on any of the platforms via email or text message. But I'm trying to think if there's any specific questions before we jump in and show them actually how comfortable the treatment is. Is there anything that you get asked frequently in regards to body?
Know, most people ask, is this like a one and done treatment?
Right.
And what we use as a standard protocol is 5 treatments, either weekly or bi-weekly, meaning once every other week, not twice a week. And for the most part, we encourage once a week for 5 weeks.
Right.
Obviously, because
to that same
area that we're going to be treating. And the reason is because you want to keep kind of hitting that tissue. You want to keep kind of aggravating it, irritating it, trying to disrupt the area in order to make sure that the body is getting the result we want. Think about going to the gym. You don't go to the gym once and get your result. You go to the gym for a period of time and then you get a result. But then there's maintenance. You know, you want to make sure you're maintaining it. Now, if we're literally destroying fat, then it shouldn't be coming back. But your lifestyle may or may not change.
And fat cells expand, right? So if you don't make lifestyle changes, or you make lifestyle changes in the reverse, you can see fat build up back in that area again. But you're right, as those fat cells are destroyed and removed from the body, those specific cells
shouldn't come back. But with muscle toning and muscle stim, you have to continue with it. I mean, that's the thing. Once you stop working out, your body starts to relax. So, and when it comes to the stimulation of collagen and elastin, we always want to treat it at least every other month in order to make sure that it maintains that youthful response.
Yes.
So, but it's very comfortable. Treatments, each area is between 15 and 30 minutes. You're really just kind of hanging out with these.
So I'd say a lot of our clients, and we can actually do a demo if you want to show on my stomach, but we have a lot of clients that'll come in and we set up the room for you really nice so that you can continue to work, not work, watch a show, not watch a show, read, lights on, lights off, music, no music, whatever is comfortable for you. We really try to make it set up to cater to your needs. So what we'll do right now, if that's okay, we'll show them a quick demo. Okay.
Put a couple on your abdomen and.
I'll take your sweater.
Yeah. So just so everybody knows, I've gone through 2 rounds. Many of our clients know I have a now 1-year-old at home. So right after he was born, I was really nervous being in my 30s that I would have what a lot of moms experience is that separation of the abdominal wall. Mm-hmm. So we did a round with muscle toning.
Yeah.
As well as the fat reduction. And then our second round, we did just fat reduction. Yep.
Hey, Ryan, can we elevate Jamie just a little bit, just for visual purposes here?
Can we bring it back up?
Okay.
Good?
Yeah, I think so.
Okay.
Yep.
All right. So I'm going to just bring that down a bit.
So for me, my area of concern always tends to be the lower abdomen. I feel like upper.
Right there.
Okay, great.
This is very simple. We're going to put both hand pieces on. We are just going to place them in the area side by side from her belly button. We're going to strap.
I can't help but help you because
it's good that you are. So cross right there. And it's as simple as me pressing the area, making sure that we have the handpieces connected appropriately. We do. It's going to ask me, are the handpieces connected? I say yes, and boom. That's it. We literally just hang out. I give her her phone, I give her some water, I turn off the lights. I come in to check on her every 10, 15 minutes or so. There is something great about the device is that we have something called the patient comfort button. So if by chance she feels that it's getting a little too warm, she can push that button and it drops it down about 15% in energy.
Well, what's really nice is that, you know, I feel the heat. Heat for me personally is a comforting feeling, but it goes in cycles, right?
Yeah.
So it doesn't stay real uncomfortable for any long period of time.
Right. Well, and what people always ask is, well, you know, how do I not burn? Because we're trying to destroy the fat inside, so you know it's getting hot enough. Well, this is sapphire glass, and it's cooled with the solution on the inside. So the surface temperature of your skin only raises by 2 degrees the entire time.
It's deeper where we're actually getting that temperature rise.
And it might be 8, 9 degrees higher inside.
Right.
I mean, it's pretty outstanding.
You brought that up and it reminded me. So right now we're treating my lower abdomen, which only needs 2 applicators.
Yeah.
Which means that if I wanted to do, say, my flanks or my inner thighs, my arms, we could do them at the same time, and I won't have to stay here for an extended period.
And we can even change the setting. So maybe we have you at 80 or 100% on your abdomen, but you don't have much on your back of your arm.
Right.
We drop that to 65%.
So it's very customized to the patient's needs, to the area you're treating, a very comfortable treatment. Truly, I mean, I haven't had anybody that's ever complained. Everybody loves it.
Yeah.
And,
really convenient, it's quick.
Yeah, so we would love to chat with anybody who is interested in learning a little bit more. If you have any questions, like I said, please feel free to send those in. Make sure you visit our website and subscribe to our newsletter so you are always up to date on the latest and greatest that Ryan puts out and the rest of our team is putting together. But thank you so much for joining us today, guys. Have a great day.
Bye.
Bye.